Cancer Awareness Month, and we just learned another star, Adashek, has been diagnosed with this disease. Now, her struggle with infertility turned out to be a blessing in disguise as she discovered the tumor during a required mammogram during her latest round of IVF. Here to tell us more about this unique detection and the connection between cancer and infertility is Dr. Adashek of Desert Perinatal Associates. Doctor, how are you?
Nice to meet you.
Thank you for taking your time today.
No problem.
This is, something that people have been talking about, because not only is Juliana at 37 very young to have breast cancer, the method in which she found it is very unique.
Yes, it is. Well, here's the thing. We do not recommend doing mammograms less than the age of 40. So apparently this doctor says, I want all my patients to get mammograms. And now, of course, he looks like a hero because he discovered this patient with mammogram. But the problem is you didn't really see the other few hundred women who probably had abnormal mammograms and then had biopsies and now has all these false positive results that you didn't get to see. So he's a hero to this one woman, but you don't know the probably a couple hundred that ended up having surgeries for mammograms that were abnormal that ended up being normal breasts.
So it is kind of a case-by-case situation, basically. So if you have someone who's come to you with fertility issues and they're under 40, is that because she'd gone through twice before IVF at different clinics and they had never required this, so it's not standard procedure, really?
No, definitely not. I'm a high-risk pregnancy specialist, but the infertility doctors in this town at least, do not do mammograms on every single patient under the age of 40 unless they have a family history or they have some of those genetic defects that increase their risk. But otherwise here, they don't do it all. They'll end up having so many false positives. What's the age cutoff? What if you're 22 and your doctor says, I want you to have a mammogram, and now your breasts are a lot denser, so it's much harder to do a mammogram, and then you get sent for ultrasounds, and then you get sent to the surgeon who says, oh, these are positive. I need to now cut these little masses out. Now you have scars on your breasts. I mean, where does the cutoff? And that's why ACOG recommends the cutoff is 40 years old.
But again, like if you have family history or anything that's unusual, if you're doing your self-exams,
and you feel
better
a
safe
mass,
than sorry, right?
Definitely. If you feel a mass, it's definitely better safe than sorry. But there's a limit to better safe than sorry. There's got to be a cutoff. And what if you're 16? Obviously, you go, well, that's ridiculous. So there has to be an age where there is a cutoff, because otherwise, the better safe than sorry, I'm going to be going to have prostate exams every 6 months. I want better safe than sorry, but I don't want to go do that.
Now, with the fertility connection with cancer, a lot of people, she brought up an issue, if she wouldn't have known and going through all these IVF and fertility and all the hormones, that could have exacerbated the cancer, correct?
Well, there's never been a study that shows IVF itself increases the risk of breast cancer or making it worse. Now, some breast cancers have estrogen receptors that are positive, and then if you get a lot of, or progesterone receptors, so if you get a lot of extra progesterone, that may make it worse, and that is correct. So if you discovered you have breast cancer, you want to, of course, take care of it before you undergo IVF.
Now, God forbid somebody finds out they're pregnant and gets the diagnosis. I'm sure that's happened before. Are they limited in the treatment they can have? Because I'm sure chemotherapy is not advised if someone's pregnant.
Well, believe it or not, I've had quite a few patients that do end up having chemotherapy during pregnancy because they're all high risk, so they end up in our practice. So they end up getting chemo. Most chemotherapy agents actually are safe in pregnancy.
Really?
There's a few that are dangerous, but I'd say 4 out of 5 are safe. So we've had quite a few patients treated during pregnancy who find out that they have breast cancer.
Well, a lot of questions it certainly raises, and especially with breast cancer, I like the pink tie.
Yes, thank you.
Breast cancer awareness. And I just think it brings a lot of point for women to get their checks. If you're 40, absolutely, you got a family history. And if you are going through fertility treatments, really talk to your doctor about what's involved.
Definitely.
Good questions to ask.
Okay.
Thank you so much, Doctor.
So nice
we appreciate it. Nice to meet you too. And we're going over to Monica. She's already got a Bambino. She won't have any more. It makes me sad.